Hello, this is Joan Meakin, CCG Cancer Lead for the Vale of York. I want to show you the new forms that will be introduced soon for the 2-week wait suspected cancer guidelines. This has come about, so it's nice to produce new guidelines in 2015. We do not expect you to remember all the criteria, and hopefully you will be able to use these forms as an aid memoir. These forms ensure that GPs are aware of the significance of certain symptoms and signs, and also to let you know that certain patients will be referred straight to test. This occurs on the upper GI form. These forms are going to be standardised with the suspected area of cancer at the top of the form. This is suspected skin cancer, there'll also be a urological cancer, etc. On the left hand side we'll let you know how this referral should be made and where it should be sent to. Over the next few months, all referrals are going to be sent electronically through the RSS system run by the CCG. As they're sent electronically, we are no longer asking you to fax these forms. On the left-hand side of this form, you'll see all the patient details. Please make sure you've got the correct landline and mobile number for the patient, as this is the way the RSS admin staff will be contacting the patient. On the right-hand side, you'll see the information for the GP and the practice. These forms will be able to be auto-filled from EMIS and System 1 systems. There are 3 statements on the forms we're going to ask you to confirm with your patients. The first statement is that the patient understands they have been referred on a suspected cancer pathway. This is important as research has shown that when patients are given bad news, it is useful to reinforce this information over a certain amount of time. The second statement is to confirm that you've given the patient information leaflet. There's a hyperlink to this information leaflet which can be printed off and given to the patient. There are 3 patient leaflets that have been developed. The hyperlink on each of the forms will take you to the correct one. This is the most common one, which will be linked to most of the forms, and it explains to the patient why they have been referred urgently and what will happen next. It also explains how they'll be contacted, and also they can bring someone with them to the appointment. This is the suspected skin cancer patient leaflet. It is slightly different, as in this case the referral is being triaged and the patient may be seen by the dermatology team in a 2-week wait or an urgent or routine appointment, or may be returned to primary care for treatment or monitoring. This is explained in the leaflet for the patient. The third leaflet is for the referral of patients with malignancy of unknown origin. There's a new pathway that's being developed. It's very important in this leaflet that it is stressed that the patient should attend for the 2-week wait appointment so that investigations be done quickly and a diagnosis be made. The third statement we would like you to confirm is that the patient is available to attend appointment within 2 weeks. It's important the patient understands they're being sent on a 2-week wait referral for suspected cancer. This is to try and either diagnose or exclude cancer. The patient should be encouraged to attend within these 2 weeks. If, however, they have other commitments, such as holiday or work, then you will need to discuss with them the implications of not attending the 2-week wait appointment when it's offered to them. One of the consequences may be that the patient's holiday insurance is invalidated if they travel having been told that they are going to be referred for a suspected cancer pathway. We'd also like you to advise you not to downgrade a 2-week wait referral to urgent if the patient cannot attend within 2 weeks. This has been done in the past so that the 2-week wait patient does not breach the 2-week wait targets set by the hospital. If the patient fits the criteria for a 2-week wait referral, then they should be referred on that pathway. There will be breaches of the 2-week wait target, but the hospital does an allowance for this, and they can cope with a 7% leeway. If after discussion the patient still decides not to attend for the 2-week wait appointment, please record the date in the box below when they will be able to attend. This is so that the RSS staff will be able to book them in and contact them to make that appointment. The RSS staff have mechanisms for contacting the patients, which will probably be by letter rather than telephone if they cannot come within that 2-week wait. This slide shows the wording that is included on the patient leaflet, which informs them about their holiday insurance. It might be very worthwhile you reading the patient leaflets just to understand how they can be used to reinforce what you've told them in their consultations.